We'd like to welcome the Chairman Chief Executive, Brigadier General M.B. Mara, retired CON OFR, and his guest, the Deputy Head, UNODC Nigeria, Mr. Danilo Campisi, and members of the UNODC delegation. With the arrival of the Chairman Chief Executive, can we take the first stanza of the national anthem as the anthem? And we all shall say, once again, we'd like to welcome the Chairman Chief Executive of the NDLEA, Brigadier General M.B. Mara, retired, CON OFR, Mr. Danilo Campisi, Deputy Head, UNODC Nigeria, other members of your delegation, Dr. Ibanga, and Sister Folusho. Thank you very much. We appreciate your coming. Special advisors, COS, directors, and members of our SPC here present. That's Special Purpose Committee. Our friends and colleagues from the media, ladies and gentlemen, we're here for this press conference in commemoration of the World Drug Day. This is the first activity to kickstart a week-long program that will culminate in the grand finale next week. And so it's my privilege and honor to invite the Chairman Chief Executive to please address this conference and thereafter the UNODC.
The country rep of the UNODC, ably represented by Mr. Danilo Campisi, members of his esteemed delegation, NDLEA management, distinguished SPC members, ladies and gentlemen of the press, good morning. I warmly welcome our valued media partners to this press briefing. Let me begin by expressing our sincere appreciation for the unwavering support you have extended to us over the years. Your reports, opinion pieces, editorials, features, and even satirical cartoons have played a vital role in shaping public understanding and strengthening the credibility of our agency's work. We are truly grateful for your continued partnership. As is our tradition each year in June, we organize a week-long series of activities to commemorate the United Nations International Day Against Drug Abuse and Illicit Trafficking, commonly known as World Drug Day, observed annually on 26th of June. Each year, World Drug Day is guided by a unique theme that shapes the global response to the challenges of drug abuse and illicit trafficking over the following 12 months. This year's theme will once again serve as a framework for our awareness campaigns, stakeholder engagements, and community outreach efforts. The theme for this year is "The evidence is clear, invest in prevention." I repeat, the theme for this year is "The evidence is clear, invest in prevention." We have lined up a variety of impactful activities, beginning with today's press briefing, culminating in the grand finale on 26th of June. These events are designed to raise public awareness, encourage dialogue, and galvanize collective action towards combating drug abuse and illicit trafficking. On Friday, June 20th, we will hold a Jumat service at the National Mosque, Abuja. The following day, Saturday, 21st of June, at 8 o'clock in the morning, we will stage a walk against drug abuse in collaboration with MTN Foundation, MTN Nigeria Foundation, and the University of Abuja at the University campus in Gwagwalada. On Sunday, 22nd of June, a Thanksgiving service will be held at Mountain of Fire and Miracles Ministries Regional Church, Uwe, Abuja, starting at 10 o'clock in the morning. We will begin the following week with the final stage of an essay competition on Monday, 23rd of June. In this round, school children will present letters that they have written on the theme, "Why I Must Not Take Drugs." The event will be held right here in this conference room in Jahi. The day will also include a range of NGO-led activities focused on drug prevention and youth engagement. Our focus on Tuesday, 24th of June will be on out-of-school youth. To this end, we will conduct an outreach campaign in markets and motor parks across the FCT area councils, beginning at 8 o'clock in the morning. Finally, on Thursday, 26th of June, which marks World Drug Day, we will hold the grand finale, a commemorative event at the State House conference room, commencing at 9 o'clock in the morning. Gentlemen of the press, that is a rundown of the week-long event for this year's World Drug Day. It is important also to look at the big picture of the country's drug use situation, what the agency has been doing, and intimate you with the latest developments within and around the agency. In terms of arrests, convictions, and seizures, we have continued on an upward trajectory. Similarly, we have begun to secure maximum sentences in the courts, with 3 such judgments recorded in recent months. We remain optimistic that some of the major ongoing cases will also culminate in similar outcomes. We are also modernizing our approach to the enforcement of drug laws by embedding innovation in our operations. Notably, the use of body cameras has now been fully integrated into our field activities. Overall, the past year has witnessed significant positive developments in our offensive against drug traffickers and barons. And we have also continued to look at the welfare of personnel. And I know as you walk in, you would have seen a number of vehicles parked outside, which is awaiting official release to the various commands in pursuit of our support of what they are doing in the field. In the 4.5 years of my leadership, the agency has been advancing steadily on the path of reform and progress. Earlier this year, in February, we commissioned our first barracks in Yola, Adamawa State. In April, we commissioned both an accommodation facility and a rehab center in Kano. At present, the barracks in Abuja stands almost ready for commissioning, while the one in Lagos is nearing completion. Yet another barracks is ongoing in Enugu. As we enter another United Nations year focused on prevention, it is vital to stress that the responsibility of shielding our citizens from harmful substances does not rest solely on the shoulders of the NDLEA. It is a collective duty, one that demands the involvement of all, including the general public. On our part, we shall intensify our war against drug abuse, WADA, social advocacy initiatives, to further support families, schools, communities, workplaces, places of worship, associations, and trade unions in raising awareness on the dangers of illicit drug use and how to avoid falling victim. This is where the media becomes indispensable. It's a task that we expect you to join us in, as you have been doing. Once again, we thank you for your presence here today and for the critical role you continue to play in advancing our mission. God bless you all.
Thank you very much.
Thank you. All these mics are a bit intimidating. Chairman and Chief Executive of the National Drug Law Enforcement Agency, Brigadier General Muhammad Bubamawa, NDLEA management, representative of the media, distinguished guests, colleagues and partners, good morning. It is an honor for me to join you today on behalf of the UN Office on Drugs and Crime at this press conference to signal the commencement of the commemoration of the World Drug Day 2025. I think it's now a tradition. Last year I was here and this year I'm repeating, so I'm very happy to be here. This year theme, the evidence is clear: invest in prevention, break the cycle, stop organized crime, resonates deeply with the challenges and opportunities we face here in Nigeria. With a national drug use prevalence of 14.4%, nearly 3 times the global average, and with over 3 million people in Nigeria suffering from drug use disorders, the toll of illicit drug use is significant and growing. Particularly alarming is the 9.2% of HIV prevalence among people who inject drugs, and the still limited access to evidence-based treatment services. This is not just a health crisis, it is a development, security, and peace-building concern. Drug trafficking and production in Nigeria represent a rapidly evolving threat, one that fuels a cycle of violence, exploitation, and instability. The expansion of methamphetamine manufacturing facilities, both in scale and sophistication, has shifted Nigeria's role from transit point to source countries for synthetic drugs. Meanwhile, within Nigeria, cannabis remains the most widely used illicit substance, and worryingly, 1 in 3 users report needing treatment and counseling, underscoring a significant gap in health services and support. The abuse of pharmaceutical opioids, especially tramadol, has also reached alarming levels, with the majority of global tramadol seizures taking place in Africa. The illicit drug trade is deeply connected to other crimes, including human trafficking, illegal mining, and environmental destruction. Its proceeds often finance violent extremist groups, further destabilizing affected regions. Together, these interconnected crimes are part of a vicious circles that entrench poverty, exploitation, institutional weakness, and addiction. Stopping drug trafficking requires long-term coordinated action to address supply and demand and prevent organized criminal groups from exploiting vulnerabilities. Most critically, we must involve the subnationals. The state governments must be actively involved in drug control efforts, working with NDLEA and other relevant entities to ensure the availability of evidence-based preventions and treatment programs in their states. We will not make significant progress if intervention continue to be centralized. This is why UNODC support to Nigeria remains resolute and multifaceted. We are working side by side with the government of Nigeria to build forensic and border management capacity to intercept drug flows and strengthen law enforcement capabilities, enhance regional responses to transnational organized crime through training, intelligence sharing, and support for joint investigations, support Nigeria's efforts to reduce drug demand by strengthening prevention, treatment, and rehabilitation services. This includes initiatives such as the Children's Amplified Prevention Services, which aims to ensure that every child experiences at least 2 evidence-based prevention interventions before reaching adulthood. It also involves the training of drug treatment professionals and the adoption of a public health approach in the justice systems, one that enables individuals with minor drug offenses to access treatment for underlying substance use disorders rather than face punitive measures. Through these measures, UNODC will continue to work with government and civil society partners to build a health-centered, human rights-based response to drug use across the country. UNODC commitment to Nigeria remains firm. We stand in solidarity with the Nigerian government, civil society, and communities in the fight to dismantle criminal chains, prevent addiction, and restore dignity through recovery. We also commend the leadership of NDLEA under the chairmanship of General Marwa, whose strategic and courageous efforts continue to make an impact on both supply and demand sides of this crisis. And UNODC is really proud to be a partner of this vital journey. So let us be clear. prevention, treatment, and recovery are not luxuries. They are life-saving investment. Together we can break these vicious circles of drug abuse, organized crime, and marginalization. And together we can build a safer, healthier, and more hopeful Nigeria. Thank you for listening.
All right. All right, thank you very much. With that, we'll now remain seated while the Chairman Chief Executive will lead his guest out of the hall. And that brings us to the end of this briefing. Thank you very much. Please remain seated while the Chairman leads his guest out of the hall, please.